Hi, it's Dr. Gemma, and I'm here today to talk about preventative measures for mental health. This is probably one of the most common questions I get asked, and it's an incredibly reasonable question because I'm a cognitive behavioral therapist, which means I think you need to change your behaviors to get better. You need to change the way you think about your behaviors to get better. And I also believe you should not have to see a therapist your entire life unless you have something very chronic going wrong with you. In other words, I'd like to train you to never use my services, which is a little self defeating, but sadly, my services will probably always be in demand. So, no problems here. But those of you on the healthier end of the spectrum, I'd like to help you avoid sitting in my office for too many sessions. Okay. Now, when you talk about preventative measures in mental health, you're talking about behaviors. And the simplest way for me to talk about that is to break them into four categories. And these categories are shorthand to make it easier for you to remember. This is what I use myself, okay? And the categories are sweat, sleep, meditate, and eat. Eating is a highly controversial topic, so I'm not going to cover it in this video. These other three I will be expanding on in later videos, but I want to just summarize them now, give you the quick start, as it were, for avoiding me. All right, so let's start with sweat. By sweat, I mean exercise, but I do mean sweat, that humans need to raise their heart rates and we need to sweat. Those are the two goals of exercise. Strengthening our body, sure, but how do we do that? We raise our heart rate and we sweat. So let's talk about, I'm going to go to the raised heart rate end of it, all right? Our bodies are essentially pumps. And really, it's a brilliant design, okay? And at the core of the pump, we have our heart, which has an electrical battery, the pacemaker, to get it running. And when the pump is up and running, it uses our cardiovascular system to spread all the goodies, the nutrients and all the healthy things, to all the remote parts of our system, fingers, toes, but also brains, hair. Well, not exactly, but I'm joking at this point. Hair's dead. No blood vessels in your hair. All right. So the idea is we need to make the pump work effectively. As we age, the pump, the extreme parts of the pump, the extremities, start to deteriorate somewhat. Okay, and the way we keep them healthy is to keep raising our heart rate and pushing the pump to work a little harder in a controlled way in exercise. All right, by doing that, we guarantee that we still get blood to our fingers, our toes, our retinas. And this is one reason people with diabetes have problems, because diabetes will accelerate the deterioration of your cardiovascular system, and it tends to go for your extremities first. So you really must exercise. Exercise is not especially efficient at helping you lose weight. So if you're thinking I'm going to exercise and lose weight, no, but exercise will strengthen your system and make it run more efficiently, and that will support weight loss. It won't make you lose weight, but when you're doing other things like eating appropriately and sleeping, that will help with the project, okay? But the main point is you want your pump to circulate well. You want food and good things to go to the extremities of your body so that you don't lose your fingers, toes, or vision as you age. But also, this strengthens your cardiovascular system, reducing your likelihood of heart attack and stroke, okay? So it is really important to maintain the pump and to keep everything circulating well in your body. Now, the other benefit here is it improves your lungs. That when you exercise, now here I am talking about aerobic exercise, okay? But for those of us with pulmonary conditions like COPD and asthma, remember you do this with a doctor's supervision while being compliant with your meds. Don't start messing with your meds because you're exercising. Talk to your doc. But it's really important that exercise is also going to flush out our lungs, helping us to avoid things like pneumonia and asthma attacks, okay? And exercise done properly will strengthen your lungs. So yeah, I've been a lifelong long-distance runner with asthma. And I'm here to tell you, after lots of marathons and half marathons, I do just fine. I just take a little hit off the inhalant in the middle of a marathon. But I will tell you also that having a strong cardiovascular system improves your pulmonary system And it has a lot of unexpected benefits. I had a high-risk birth in my 40s. At the end, when I didn't die, my PCP, who was a wonderful, wonderful soul, went through all the reasons I should have died and then said, it's probably your running that saved your life, that it strengthened your heart and your lungs so much that you got through a very difficult birth experience. So yeah, exercise is not to be taken lightly, and when you're pregnant, it's especially important, okay? Now, the other great thing about exercise, over and over again, research has shown that it regulates your mood. And that's so critical if you have a family history of mood disorders such as anxiety, depression, or bipolar, that the exercise is going to help regulate that and control your energy levels. And that's what you're here for, right? We're talking about mental health, but all these other things affect the way you feel. Obviously, after a heart attack, my mood and my body aren't going to feel so great. So I'd like to prevent all that from happening. That's the extreme example, but that's what we're in it for, guys. If you want to not see me, you have to exercise, okay? And you have to exercise appropriately, and you should do it with a medical doctor's supervision. All right, don't just go out there and bust your hump. It never works. But you do need to exercise. Now, since I've already mentioned the magic word, sleep, let's go there. Sleep is critical, and of course, the first way you maintain it is exercise, is good, healthy exercise routines. Sleep helps to regulate your mood as well. And we do know that several bad things happen without enough sleep. Recently, they published yet another study validating the fact that lack of sleep seems to make people more prone to heart attacks. So sleep and lack of sleep seem to be contributing to the health of your cardiovascular system. So guys, we need to get sleep. And that means 8 hours of sleep for the average adult, more for kids. And I'm going to talk about how you do that in later videos. But basically, sleep regulates mood. Lack of sleep. Most people, we have lots of studies that show that most people believe that they are sleeping less than they actually are sleeping. One way to know is just get one of those wristwatches, a smartwatch that measures how much you sleep. Fitbits do that for a reasonable price. You can get one for like $80. So if you're curious about how much you sleep, please try it, because you do want to be trying to get 7 to 8 hours a night if you're an adult, okay? If you're sleeping less than that, well, we do know lack of sleep brings on mania. And there's a lot of questions around what pre-existing conditions have to be in your body for that to happen. There are studies that suggest that you don't have to be bipolar to bring on manic type symptoms if you're not getting enough sleep. Okay, that the stress level in your body goes up and you'll be agitated and you'll act somewhat manic, which is hypomania, low-level mania, okay? And I'm not going to go into the differences here. If you have a tendency towards bipolar 1 or even bipolar 2, which is the lower level of mania with depressive cycles as well, then lack of sleep is going to bring it on. So if you have any history of bipolar in the family, for heaven's sake, you need 8 hours of sleep, okay? But sleep interacts with exercise in a very complex and beautiful way. So if you're trying to exercise and you're not getting enough sleep, I want to wish you luck with that, because I've been doing that for years, and I'm here to tell you, you have to regulate both of them, okay? But you do need to sleep. You do need to be aware, people come into my office all the time and they're not sleeping, and that is associated with many mental health disorders. And we are trained to look for it. There are physical signs when someone's not sleeping. Duh. They're yawning. Their skin color isn't right. Their skin can look waxy or chalky, circles under the eyes, red-rimmed eyes, I said yawning, yeah, being tired, slouching posture. There's a lot of indicators that give it away. So, I always look magical because I'll say to patients, I want you to get more sleep. And they'll say, how did you know? Well, it does show all over you guys. But you need to work on the sleep for your mental health. Okay, now most sleep medications I wouldn't recommend because they're addictive, hello, and you get dependent on them. So we'll do sleep hygiene in a later episode. But I'm here to tell you, you're not going to have good mental health if you're not getting good sleep. It's just as simple as that. Okay, the third is meditate. Now, I say meditate. What I really mean is the bigger picture of use mindfulness. Oh, mindfulness. I've been to so many bad trainings on mindfulness because it's a big trend in my profession, but it's a hugely important thing. If you really want to learn about mindfulness, go take a yoga class. I know any males in the audience just got turned off, but remember, yoga is just stretching. All right. And you can do it at home with a video, guys, okay? But in yoga, the great thing about yoga is it enforces meditation. It enforces mindfulness, because when you're doing yoga, particularly standing poses, if you're not fully focused, you're just going to fall over. All right, so there's a lot of ways to achieve mindfulness. And I guess my gripe is when you go to a class and they say, here, eat this chocolate chip cookie mindfully. How does that affect the rest of your life? Mindfulness is a much bigger practice, but the shortest cut to it is to try to meditate every day. And yeah, I will do a video on how to meditate, all right? But mindfulness means being in this moment right now, not being anywhere else. How do I do that? And when does that happen? When do I go other places? Okay, well, if I'm sitting here worrying, I'm now in the future. And indeed, most people with anxiety problems are spending a little too much time anticipating a negative future. What a waste of time. The future hasn't happened. So I had a patient who comes down our drive to visit my office, very anxious guy, and he arrives late because of a traffic jam. And I don't worry about it. He's so conscientious. So he shows up 15 minutes late, and he's all embarrassed, all apologetic. And I knew, he didn't call me because I knew he's probably in really bad traffic. He's coming through a high traffic zone. Gets to my office all worked up. He says, I thought you would be angry. I said, why would I be angry? You've been a good patient. I trust you. Something's gone wrong. I can trust you. And he looked at me and he said, you mean I wasted all that time being anxious? And that's exactly what he'd done. I love this guy. I miss him. That when you worry, you're setting up a negative future that may not come true. So why are you worrying? Well, when you worry, you're releasing corticosteroids, see the earlier part about exercise, and you're damaging your own body. So we don't want you to do that. We don't want you to anticipate negative futures. It's often been said, and you could argue this, but it's often been said that depression is the opposite. Depression is, I've had so many bad experiences, I can't let go of them. And that's living in the past. Depression also involves a negative future anticipation, let's be honest here. But it's a simple shorthand, okay? That the depressive side is more about not being able to let go about a negative past. So when you're thinking about bad memories, you're dwelling on a negative past. You can't change the past. Why are you spending time there? Okay? Trust me that someday when we face that big exodus from planet Earth, when that last lightning strike where we pass into the great beyond, I promise you'll have time. You'll be lying around thinking about the past. You don't have to do it now. The past is there for us to learn from. It's this wonderful thing we use our prefrontal lobes to do in the middle of our brain. I believe it's in the hippocampus where we keep autobiography. And that's fabulous. And we're supposed to use the past to learn. That's what the tool is for. If you're using the past for anything else, you're abusing it and you're abusing yourself. You're abusing a wonderful tool. So the whole art is to be mindful, to stay in the present. Now, some of you are saying, but there are people who are too much in the present, who can't plan for the future, who can't anticipate or work out the answers to problems. That's true. That's impulsivity. That's a mental health issue. But I'm assuming if you're watching this, probably you're able to work with that with me, and we'll talk about impulsivity later, okay? But the reality is, when I say I want you to live in the present, I will talk about this in the dog named Lightning later on, but I want you to be able to recognize there are things you must plan for, and you make good plans. We all need car insurance. I hope we can all afford it. We all need to plan for our death someday. We got to have life insurance, all right? There are things we plan for, and that's fair enough. But once you've planned for them, you can let them go and live right here in the present, okay? So there you go. Those are the basics, and you can tell there's a lot more that can be said about all of them, but I want you to start focusing on those 3, if not 4 things. Yes, I would like you to eat properly. The reason I'm not going there, it's very controversial what that even means. All right, so that's going to be a much bigger topic, and it brings in issues like fat shaming and body imagery and all that. But for the meantime, remember the 3 big ones, and I'm going to post an image with this so you can see the 3 big ones. But it is sweat, sleep, meditate, parentheses, eat, okay? Sweat, sleep, meditate, eat. There we go. And I'll see you next time. Thank you so much. Thank you for the coffee donations as well. And thank you for hanging in there with me for this one. Everybody stay safe, take care of each other, and I'll talk to you soon. Bye-bye.